Are cancer vaccines safer than chemo and radiation for colon cancer? Imagine having options beyond traditional treatments that might cause fewer side effects. That's what cancer vaccines are aiming for in the fight against colon cancer. But how do they compare in safety to the well-established methods like chemotherapy and radiation? Let's explore the facts. Colon cancer, also called colorectal cancer, is a major cause of cancer deaths worldwide. The main treatments have been surgery, chemotherapy, and radiation therapy. These treatments have saved many lives but often come with significant side effects. Chemotherapy uses powerful drugs that kill fast-growing cancer cells but can also harm healthy cells, leading to fatigue, nausea, hair loss, and increased infection risk. Radiation therapy uses high-energy beams to target cancer but can damage nearby healthy tissue, causing bowel issues, skin changes, or fatigue. Both are proven to improve survival but can be tough on patients. Now, cancer vaccines are a newer approach. They work by stimulating the body's immune system to recognize and attack cancer cells. Unlike vaccines that prevent disease, most cancer vaccines are therapeutic. They are given after diagnosis to help fight the existing cancer. These vaccines often target specific mutations, like the KRAS mutation, which appears in about half of colon cancers. Early studies suggest that these vaccines are generally safe and well-tolerated. For example, trials testing vaccines made from donor cells or targeting KRAS mutations report mostly mild side effects, such as injection site reactions or mild flu-like symptoms. This is a contrast to chemotherapy and radiation, which often cause more severe side effects. However, it's important to remember that cancer vaccines are still in the research phase. Most data come from early clinical trials focused on safety and feasibility, not direct comparisons with standard treatments. While initial results are promising, larger studies are needed to fully understand their safety and how effective they truly are. In terms of effectiveness, chemotherapy and radiation have decades of evidence showing they can significantly improve survival, especially when combined with surgery. Cancer vaccines have shown potential in boosting immune responses and possibly lowering recurrence risk, but they haven't yet demonstrated the same broad, proven benefits. An advantage of some vaccines is that they can be off the shelf, meaning they are ready-made and easier to administer than personalized therapies. Still, not all patients qualify for current vaccine trials, which often target specific genetic features or minimal residual disease after surgery. From a safety perspective, early evidence suggests that vaccines may cause fewer and milder side effects than chemotherapy or radiation. This could be especially helpful for older patients or those with other health issues who might struggle with the side effects of standard treatments. But safety is only part of the picture. Effectiveness remains crucial. Right now, vaccines are not replacing chemotherapy or radiation for most colon cancer patients. They are being studied as additional options, especially for those at high risk of recurrence or with limited treatment choices. Major health organizations still recommend chemotherapy and radiation as the primary treatments because of their proven benefits. Cancer vaccines are considered emerging therapies, with ongoing research to determine their role. Combining vaccines with other immune therapies is also being explored to improve outcomes. If you or someone you know is facing colon cancer, it's essential to discuss all options with your healthcare team. Participating in clinical trials might give access to promising new treatments like vaccines. Remember, each person's situation is unique, and treatment decisions should be personalized. In summary, early research suggests that cancer vaccines might be safer than chemotherapy and radiation, with fewer side effects. But they are not yet proven to be as effective for most patients. Standard treatments remain as the mainstay of colon cancer care, supported by extensive evidence. Vaccines hold promise as future options that could someday offer safer, effective alternatives or complements to existing therapies. Always consult your healthcare provider to find the best approach for your individual health needs.